We're privileged to have Dr. Monica Williams-Murphy to share her insight into this question that will impact us all as physicians or as patients ourselves. Dr. Williams-Murphy is an award-winning writer and board-certified emergency physician with expertise in medical directives. She practices in one of the largest emergency departments in the nation at Huntsville Hospital, where she also serves as the community as a medical director for advanced care planning and end-of-life education. Additionally, she serves on the board of directors for both Hospice Family Care and Anam Cara Los Angeles. Did I pronounce that right? Close enough. Dr. Murphy is a medical expert and contributing writer for thirdage.com, the leading online baby boomer lifestyle site. She is on faculty at the University of Alabama at Birmingham School of Medicine, Huntsville campus, and is an appointee to the American College of Emergency Physicians End-of-Life Task Force. Her writing and speaking focus is on empowering patients and families in critical and end-of-life decision-making, and her consulting work centers on the same. Her book, It's Okay to Die, and companion website are tools for transforming the end of life into a time of peace, closure, and healing. Dr. Murphy's blog has also appeared in the New York Times Health Around the World column. Her lecture has been broadcast nationally by the Alabama Department of Public Health and received rave reviews at the National Hospice and Palliative Care Organization's Management and Leadership meeting in 2014. Her end-of-life preparation checklists have been adopted by the UK NH campaign Be Ready For It, endorsed by the Norfolk and Suffolk Palliative Care Academy. She also hosts the trendy Death Cafe in Huntsville, Alabama. So we're delighted to have her here, and please welcome me and join her.
Thank you. It's an honor to be with you. That was a lot of boring information about me. I'm sorry about that. So you know some things about me. Let me make sure I'm very clear on who all is here. Please raise your hand if you're a medical student. Yes, awesome. Thank you for coming. Residents, raise your hand. Very good. Attendings, physicians, raise your hand. Wonderful. Any dentists, raise your hand. Raise your hand if you do something far more interesting than anything I mentioned. Yes. I may or may not want your job, so, all right. And by the way, I do feel like I'm home. The Gulf Coast is home for me. I did go to the University of South Alabama Medical School, and I think Dr. Umana taught me. I just don't remember. I was sleep deprived. It was long before the era of resident work hour limitations. I was a med student there. Went to University of Virginia for emergency medicine. So let me start with a couple of very dumb questions. They say there are no dumb questions, but these are dumb. They're simple, just to orient us to our evening. Please raise your hand if you've ever had a patient who died. Yeah. Please raise your hand if you've ever had a family member who died. Please raise your hand if you've ever known anyone who's died. Please raise your hand if you've ever died. This gentleman has his hand up. There's usually one person in the crowd. Don't be surprised. And so the point being is that death, dying, and the end of life is one thing we all have in common, but very few people talk about it. Now, in contrast, we all talk about the beginning of life. We enjoy talking about that. From the moment someone pees on a stick and it says positive, we have planned what that new baby will wear home. Grandparents know exactly, they've already worked it out in their mind, exactly what things are going to look like and the whole event. And we have the sex reveal party. You know, it's all very interesting, elaborate cultural celebrations about the beginning of life. We plan for it and talk about it, and things generally go our way because it's a topic of conversation. But in contrast, very few people talk about the end of life. If you don't talk about something, you rarely plan for it. If you do not plan for it, things rarely go your way. And it is the rare person who can celebrate the end of life. But I think we need to change that, you see. In medicine, we've lost our way. We have reduced death and dying to a medical event. And true, it is a medical event. It's a physical event, but it's also an emotional event, it's a social event, it's a family event, it's a spiritual event. And we have to make space in medicine to recapture that. That is something we have lost with the advent of modern technology. Everybody on the street out there thinks that we have the eternity pill in the hospital or the shot to make death optional, right? And we're not talking about it. So our patients think that Maybe this topic doesn't apply to them, but that's wrong. We fail patients when we do not prepare them for the end of life. And my really strong words are this: it's moral medical malpractice when you don't tell your patients where they are on the map of life. We rob people of the opportunity to create closure at life's end if they don't know the end is coming. So I'll beg you tonight to reintroduce this topic to your practice. Get comfortable talking about it. We already talk about taboo things. We ask people, do you want to kill yourself or others? Do you have sex with men, women, or both? Right? Why not add one other taboo thing to your questioning with your patients? You can do it. So I'd like to tell you about a moral crisis I had in 2010, which is the reason that I'm even here. See, I'm an emergency physician. I'm not trained in hospice or palliative care, and I'm here talking about a hospice-esque topic. So how did that happen? Like, I'm an acute care doctor. How does this relate? Well, being trained in the emergency aspect of medicine means that if you're 80, or 180 and you roll in the ER, you're dying. My entire instinct and reflex is to do everything to save your life. As a matter of fact, when I was in the Atlanta airport earlier today, I saw a guy looking kind of diaphoretic and holding his chest. I already identified the AED. I was ready. I'm trained to do that. It's almost as natural as breathing, okay? So it's very hard for me to think and stand down rather than act. So that's my background. In 2010, I applied that instinct indiscriminately, regardless of where someone was in proximity to the end of a natural life. Unless they roll through the door waving a DNR, I didn't ask anybody questions at all. I just acted on the moment. One night at 4 a.m., something changed for me. We have an 86-bed ER, very